Hey guys, today is February 24th, 2019, and that means that I am officially 4 months post-op top surgery. I had top surgery October 24th, 2018 with Dr. Tobias in Boston, Massachusetts. I just want to make a video today, just a little update, kind of talk about my experience with Dr. Tobias and what recovery was like for me, and basically how that went. So anybody who's trying to, is looking into getting top surgery with him, I'll kind of talk about the process that I went through, how the staff was, and show you guys my results, and yeah. So I had a friend who had seen Dr. Tobias and had gotten surgery from him, and when I was looking at surgeons, I was trying to find someone that took insurance. I originally really wanted to go to Dr. Garamoni in Florida, but he doesn't take insurance. And so when I was looking around, my friend said that Tobias took insurance and he took mine. So he kind of told me about his experience and said it was really good. I liked his results. So I tried getting in contact with Dr. Tobias' office for a consultation. So I don't think... I had to call quite a few times, and I think there's only one receptionist there, so it definitely took a little bit of time to get a hold of someone, but once I did, she told me exactly what I needed, and so I needed a letter from my therapist and a letter from my doctor, and once I had those two letters, I would email them those letters, and then they would call me back and set up a consultation, so you can't even have a consultation without having those letters. So I think it might have been a few months. I was booked out for the consultation once I got the letters and everything, because I think I had the consultation in August, and I feel like it was June when I had gotten everything all set. So it took a couple months for the appointment. The appointment was right in Boston at his office, so I went there, I met him, they had me fill out a bunch of forms just about my medical history, my parents, just kind of standard forms, and then I met with him. He showed me pictures of the results that he's done. We talked about what type of surgery would be best for me. Before he even saw my chest, I was I'm pretty sure double incision. I said, "You saw my chest?" He was like, "Yes," because I was probably a B cup or a C cup. So double incision was the best choice and option for me, and he agreed. So he took pictures of me. I was sitting against a wall. He took pictures head on, completely to the side, tilted a little bit, and then the other side tilted a little bit. So he took all those pictures. He said I looked like a good candidate for double incision, so then he was like, we'll send stuff over to your insurance. If it gets approved, then we will call you, and you can set up a surgery, a date for surgery. So as I was leaving the office, the woman was like, okay, we're going to contact your insurance. It might take a week or so. We will give you a call and let you know if they accept or deny your request for surgery and covering it, yada yada yada. So it was maybe a week and a few days. She called me and she was like, your insurance accepted it, so do you want to set up an appointment? How do you want to go about it? And she was like, there is the $1,500 cosmetic fee that is not covered by insurance. You would have to have that completely paid first before your surgery date, and you have to have I forget what the percentage was, a percentage of it down to even make the surgery appointment. And I was like, I will pay the $1,500 right now, all at once. I just put it on a credit card. I was like, I know this is what I want. I can worry about paying that back later. So I was fortunate enough to be able to do that. I know everyone can't do that. So I, right over the phone, gave her my card information, and the earliest date he had because this was August, and he had a date pretty early. He had a September date, and I was like, that's definitely a little fast. I want to make sure that I have enough time with my work to get the time off. And she was like, okay. She's like, so when are you thinking? And I was like, October-ish. And she has some earlier dates in October, and I ended up settling for the 24th. And I was like, I think that should be fine, because that's when my work should be slowed down by then, and I knew I was going to have to take about 6 weeks off for work. So that gave me enough time to let my boss know what was going on and try and get that time off. So that's when I scheduled surgery for. So I'm trying to think, like, the next. So I think a week before my surgery date, I had a phone call from a nurse practitioner, and she just asked me if I had any questions. She was letting me know what medications to stop taking. They didn't say anything about stopping testosterone. I know some guys had to stop taking testosterone. I'm not sure why that is, but they never said anything to me about that. They just said, like, no Advil, no Tylenol, like, just no blood thinners, and, like, all the medications I was taking were fine, so I could continue to take those. And she just asked if I had any questions. And then I don't think I had to do, I think I might have had to do, like, blood work before that. But anyway, so my surgery was on a Wednesday, right? Yeah, I think the 24th was a Wednesday. So Boston's about an hour away from me, and so I stayed over at my mom's house because she was going to take care of me for a week. My surgery, I think, was scheduled for, like, 9 in the morning, and I had to be there, like, an hour and 30 minutes early. Or maybe the schedule was scheduled for 10 or something. I had to be there at, like, 8:15 or something like that. And it ended up taking 2 hours to get there with the Boston morning traffic, so I was about an hour late, which was, like, so nerve-wracking. And I had to call the office. I was like, I'm so sorry, I'm stuck in traffic, I will be there shortly. So we were rushing to get to the hospital that was there. They did it at Beth Israel Medical Hospital of Boston, which is, like, right next to Fenway Park, so it's, like, getting there was pretty crazy. But it seemed like, even though I was an hour late, it seemed to be okay. Like, he wasn't, the doctor wasn't even there yet. Like, he doesn't come until, like, right before I'm ready, and they give, like, that hour and a half time to get you totally ready, but they just kind of, like, okay, we're just gonna rush through this, like, change. We're gonna put the, get the IV all set up, get you all ready, like, and he'll be here soon. Yeah, I met the anesthesiologist. She was super nice. I think that's a teaching hospital, I believe, and I think he was saying he sometimes has, like, students come in. So I think there was another kid that was there that was kind of a student that I met as well, and so they set up the IV and everything, and I feel like they set up the IV. I don't think there was anything in it yet. Like, I don't know what they. I told her that I would probably, like, throw up. I was like, I'm get nauseous pretty easily. So she put something in there to help with nausea. And I'd never been under anesthesia before. So I was like, I don't know how my body's going to react to it. And, like, my mom said that, like, people in our family usually wake up and they throw up, or they wake up and they're having a panic attack. So I was like, cool. Don't know what's gonna happen, but at least they can try and prevent, like, the vomiting situation. So they gave me whatever medication helps for that, and basically waited for him to get there. Dr. Tobias showed up, and he had me stand up. He drew on me, just kind of, like, markings and everything. As soon as I stood up, I felt kind of lightheaded, and he was, like, really nice, and he was like, if you feel weird at all, are you okay? And I was like, oh, I feel a little lightheaded. And he had me sit back down, lay down. Like, he was really, like, courteous about it. Like, he wasn't, like, upset that I like, had to, like, take a minute, which was really nice. And he was like, yeah, no, not a problem. Like, we'll wait till you feel a bit better. And then I stood back up. He finished drawing on me, and basically I remember, like, being wheeled in into the room, the operation room, and they were like, it's gonna be really bright, it's gonna be really cold, like, just letting you know. And I was like, okay. And the last thing I remember is being, like, slid onto the table, and then that, like, that's it. And then I woke up and everything was done. So I don't even, I mean, I think I kind of remember her putting like the mask on me, and then I was just like out, like instantly like knocked out. And when I woke up, I remember like hearing them talking to my mom, and I could hear them on the phone, I think, and they were like, oh, he's all done, like surgery went really well, like blah blah blah, he's still sleeping. And like I do this when I sleep anyway, where like I'm, even though my eyes are closed and like I'm asleep and everyone thinks I'm asleep, I can hear everything. I just don't like move. So I was I was kind of doing that, so they kind of thought like, oh, like why isn't he waking up? But when I was like finally like had my eyes open, they're like, oh, you were sleeping for a while, and I was like, oh, I've been awake this whole time. Like it's totally fine. Like I do this normally, and they're like, oh, okay, like you just want to make sure that you were fine. And I was like, no, I'm fine. I was like, I'm like need water like really badly, like because you can't eat or drink like the night before or whatever, you have to stop. So I was just like so thirsty and so hungry, and like felt a little bit nauseous too. So I think they gave me more medication in my IV, which my IV was kind of like twisted up, like it wasn't really in right. So they really had to like keep adjusting it, keep taping it. Like I had a lot of tape on my arm for like quite a few days that would not come off. But otherwise, they gave me some ginger ale and some crackers, and there was like, I had basically had like my own like nurse who was there the whole time, and she was really, really awesome, really, really patient. And so she got me like the little shortbread crackers and ginger ale. I was, you know, she was like, slowly eat them and slowly drink. And within like a few minutes, I was like, I'm gonna throw up. And she gave me a thing, and I was like, what? Threw up. And I was like, it wasn't as bad as I thought it was gonna be. Like, I don't know, like I just knew. I was like, I'm gonna throw up. And it wasn't like a painful like throw up, I guess. It was just like, this is what's happening. So then they tried to give me more nausea drugs, and at one point she was like, you really have to try to go to the bathroom. So she wheeled me to the bathroom, and on the way back I was like, I'm gonna throw up again, like I can't. So I threw up again, and then she's like, okay, we're just gonna like stop with the liquids and stuff, like I know you're really like thirsty and hungry, but we'll just wait on that. So, but honestly, it wasn't like I wasn't in any pain. You know, I think I had like a bandage over me. But he doesn't, so Dr. Tobias doesn't have like a, he puts these like nipple bolsters on, and then he puts glue over the scars, like a surgical glue. And then he didn't put like a compression vest or anything. So, and then I had drains on each side, and the drains are like taped to you, kind of like they stick onto these little like sticky pad things. So he doesn't, you don't, I could see my results like right away, which was really cool. Like the nurse kind of she showed me my drains, and she, like, I don't know what, I feel like, I can't remember if there was something there or not, I don't know. Might have just been like my gown, and she was like, you know, this is your chest, like, you know, your nipples are covered up, whatever. But otherwise there was no other like protection. There was no compression vest around my chest when I woke up. So right away I was able to see pretty much everything. And she showed me like, you know, how to take care of my drains and how to monitor them and everything. So I think since I threw up and I hadn't gone to the bathroom yet, they kind of they wanted to wait until I went to the bathroom pretty much before I left, because they just wanted to make sure everything was okay. So we were there for like a long time. I think from like 9 or 10 a.m. until like, we didn't leave until like 6 p.m. And I think the surgery was probably done around 2 or so. And in that time, my mom went to the pharmacy and picked up all the prescriptions and stuff like that. So pretty much after, they just let me sleep to try and get rid of the nausea and everything, because they didn't want me like, you know, driving home and get like motion sickness. And they also had to like get me in a wheelchair and like wheel me across the other end of the hospital to the parking garage. So the nurse was really awesome. She stayed with me the whole time, or would, check in on me. Um, and then when I was finally like awake again, I was like, I feel okay. They got me in the wheelchair, and so the nurse was trying to describe to my mom like how to get back to like the parking garage. My mom was just like, I don't know. So the nurse was really nice, and she like wheeled me through, like took me through the entire hospital, and was like brought me directly to the car with my mom and everything, which was really nice. And we got the car, and I think I brought a pillow with me to kind of just have over me, and then have like the seatbelt over the pillow because I didn't really have any other sort of protection. And then we drove home. It was about like an hour, and I don't think so the prescriptions that they had written me were, I think they gave me oxys, like 36 of them or something like that, and then extra strength Tylenol, and then some sort of like antibiotic thing. So the antibiotic I had to take every 12 hours, and then extra strength Tylenol every 4 or 6 hours, like that. So, or every 8 hours. I don't know. I had to take it like quite often. I had like alarms set on my phone. So I never ended up taking any of the oxys. I wasn't in enough pain to need them. Honestly, the extra strength Tylenol seemed to be what worked for me. So yeah, I had like alarms on my phone set for like 3 a.m. Like, so 3 in the morning I would like take the Tylenol, and I think it was like 8 and 8 was also when I took them, and I also took so almost went every 6 hours. Like 8 a.m. and 8 p.m. is when I would take the antibiotics, and then like 3 a.m., 8 a.m., 3 p.m., 8 p.m. is when I took the extra strength Tylenol. Yeah, so and I took all those for the first week. So I had the drains in, and I didn't have a compression vest from the surgery, which was October 24th, and then I think Halloween was the following Wednesday, so my post-op appointment ended up being Thursday, the November 1st, so that's when I ended up getting my drains out, so I had them in for 8 days instead of 7, like normally it's a week. I don't know, he's usually in the office on like Tuesdays and Thursdays, so I don't know if that's just like how that ended up working out, or if it's because it was Halloween, I don't know. So yeah, the drains came out, and I did not feel, it was not painful at all, did not feel anything, like they had like a couple stitches, like stitch in, and she just like, I don't know if it wasn't like in that much, like some people say they like feel it coming out. I literally must have like been in like that much. I don't think it was far in. I did not feel it at all. And it basically, once they take it out, you just let it be. Like she put some gauze on it so it doesn't like drip on me or anything like that. But she was like, when you get home, take the gauze off, and like the hole will be sealed up by that time. And then she gave me, it was almost like an ace bandage, but it had like Velcro on it, so it's just like a long white thing that had Velcro on it, so it would just go around and like make it as tight as possible and like stay on. And so I had to wear that, so that was almost like the compression vest, but that was after like the drains were out and everything. And she took the drains out, and she took the nipple bolsters off also at the same time, so I was able to see my nipples. And she told me how to take care of those by cutting off it's like zero form stuff. It's basically like it was like gauze that was like soaked in Neosporin, basically putting that on, putting like gauze on top, putting the bandage on, the ace bandage type thing, and had to do that for 3 weeks, or it ended up being like 2. They said like 3, but like I think they meant like 3 weeks as in like 3 weeks from the surgery. So for 2 weeks I wore that and did that. So 8 days post-op, that's when they removed the nipple bolsters, and they took the drains out and everything. So that was a Thursday, and she was like, you can't shower until Saturday. So Thursday, Friday, Saturday, so the 10 days post-op is when you can shower. So I couldn't shower at all that like whole time, which was like definitely hard. But it's weird because I didn't like smell, and I don't know if it was like I couldn't wear deodorant or anything either, or at least I don't think I could. but I didn't smell like that whole, like those whole 10 days without showering. I don't know if it's like you have to wash your body the night before with, oh, I can't remember what that stuff is called. It's like a, I feel like it's an age. I don't know, it's like this like soap that's like brown, and they use it in hospitals to clean you, whatever. Like, I don't know what that stuff was, but I literally didn't, I mean, I wasn't doing a lot of physical activity either, but like, was still, like, I didn't smell at all. But I was still really excited to like take a shower. I think I used baby wipes, like, but still, like during those times, the 10 days. But yeah, so she was like, don't shower until Saturday. And I was like, okay, I thought I was gonna be able to shower right when I got home. So 8 days post-op, everything is off. I have the bandage on. I get home, and I take the bandage thing off, and I take the gauze off. And I think when I took one of them was totally like fine, like it was totally closed up, and then the other one was like, had like a scab that like got on it. Like when I show you my results, I'll show you there's kind of like a scar there where it, I don't know why that happened, but like it almost like the gauze like stuck to it, like it might have been like leaking out, and the gauze stuck to it, and so when I took it off, it like made a scab or something. I don't know. So anyway, so every day I was once I could shower, every time I would get out of the shower, I would cut the squares for the Xeroform antibiotic stuff. Put it on my nipples, put gauze over it, put the Velcro bandage on, and I kept that bandage on like 24/7, except for obviously when I would shower. And every day I had to change the nipple stuff, and then I went back 2 weeks later, and that's when I saw Dr. Tobias again. Like, he wasn't at my other appointment, like a nurse practitioner cut off and took out all the drains and everything. So I saw him, he took more pictures, he said that I can stop wearing the compression vest thing, which I think was getting like so gross and smelly. Like, I don't know if I could wash it. I wish they'd given me 2 of them. Like, maybe ask for 2 if you go. But it was gross, it was getting gross. And I was afraid to wash it because I was like, if I wash it and I ruin it, then I don't have one. But that's one thing I wish I would have like asked or gotten a second one. But so then I saw him at my appointment, so that means I was 3 weeks post-op at that point. He looked at my nipples and he said that to just keep putting that I don't need to wear the vest anymore, but to keep putting the Neosporin gauze stuff and gauze over it until all the scabs come off, basically. So I think a few days after that, one of my nipples was totally like fine, didn't need to put the stuff on anymore, and then the other one took like a few more days after that. And then at that point, I was totally like fine, like I didn't have to take care of it anymore. It was good at that point. Also at the 3-week appointment, he said to start doing scar massages, and that was like, I like couldn't. That was very hard, I would say, that early on. Like, I was surprised it was gonna be that early on. I don't know, I just like, I couldn't mentally do it, and I couldn't like, and it's not like it hurt, like nothing hurt like the entire time. Like, I was never like, oh, I'm in so much pain. Like, I don't know if he's just like a super gentle surgeon or what, but like I had no bruising, there was just nothing, like it was totally fine, but touching like the scars, and it was just kind of like a really, really strange feeling. Like, I don't know how to explain it, because it's kind of numb in some spots and it's kind of not, and it like doesn't really like hurt. It's just really strange. It's a really weird feeling, and I can't really explain it. But he wanted me to do the scar massages, and I just like couldn't do it for like a few weeks. And I bought like Palmer's cocoa butter with vitamin E in it, and that's what I was like trying to use to massage it as much as I could. I've been using it more like consistently now, and I just switched to using like scar strips, because I was like, well, if I have to massage it, I don't want to put like scar strips on it. Like, how do I like figure that balance out? And Dr. Tobias didn't really have any recommendations for like scar care. He was like, there's absolutely no proven method for what works. So he's like, I like try whatever you want to try. Like, some people use scar strips, some people use vitamin E, coconut oil, like there's so many different things out there, and he's like, there is no proven method that works to get rid of scars or anything like that. He's like, as long as you are massaging them with something, some lotion, whatever it is, like, that's the best thing you can do. If you want to try scar strips, whatever, if it works, awesome. Like, he's like, I can't, there's nothing that I know that works provenly, so I'm not gonna make you buy stuff or whatever if I don't, you know, there's no proven, like, scar care, basically. Which is like, you know, he's honest, is like, straight up, like, you know, everybody's body is different, so, so yeah, I bought that cocoa butter stuff, was using that to do massages. It worked pretty well. Didn't get on my clothes, wasn't oily. Like, I would just take a shower, massage them, and put a shirt on and be fine. And yeah, and I bought scar strips, like silicone scar strips, and I started using those recently, and those seem to be working like really, really well. And I was like, well, I wish I was using those earlier, but I was afraid to. But I had my like 4-month post-op appointment with him, and I was like, can I use scar strips now? Is that like cool? And he was like, yeah, like go for it. I think that would be fine. So I was like, wanted to just check in with him before I like kind of stopped massaging them in a way. He was like, if you can kind of massage the scars over the scar strips, like that'll be like a bonus. So, I'm trying to think if there's anything else in between those times. Yeah, so I had my 4-month appointment on Tuesday last week. Today is Sunday, so it was kind of like not quite exactly 4 months or whatever. It's just the way it ended up working out, because he's in there on Tuesdays and Thursdays, and that's just how the like appointment scheduling went. But yeah, otherwise, overall, I think I had a really good experience. You know, where the office is like, it is in Boston, it's a little crazy, but there's parking, the parking garage, it's like $10 to park there. It's like not the worst, and you know, his office staff was like friendly enough, all the nurses were really nice, like he was nice. My 4-month appointment, he took pictures again, the same pictures, and he said that like if I wanted them I could just like sign off on it, which I'll probably do. And then he was like, if you don't have any other issues, like you don't need to see me. Like, he's like, if you add a year, that's when everything should be healed. Like my nipples are kind of like different, like the outside is darker than the inside. And he was like, you know, he's like, I tattooed one Caucasian guy who was really particular about his nipples. Like, I tattooed them to be more even, but like, honestly, I there's no one else I've had to do that with. He's like, I think they'll just even out, or he's like, they look really good to me. But he's like, if at a year mark, like you aren't happy with them, let me know. I'll see what I can do. So I don't know. I'll just see where I'm at with a year, and that's just when everything is like fully healed is 1 year. So it's like kind of the benchmark to decide whether I would need any revisions or anything like that. Or if he's like, if you have any questions, anything, but he's like, everything looks great, like, keep doing what you're doing, and if you need me, you can contact the office, but otherwise you're good to go. We don't need to make like another appointment. So yeah, I think during, like, I'm trying to think of like during recovery what really helped me. For the first few days, I couldn't really, like, my movement wasn't that much. I couldn't reach, my mom said she had a microwave above the oven, and so I kind of had trouble with that. I couldn't, like, someone had to come over and heat up my food because I couldn't reach the microwave. But otherwise, obviously, keeping everything at, like, level and, like, brushing my teeth was a little bit hard the second day. I was able to, like, go to the bathroom on my own. I, like, didn't need help. And, like, when I was showering, 10 days post-op, I was fine by myself. Just, like, you just have to keep your back to the shower. Obviously, you don't want to, like, hit your chest directly with the shower water. But, yeah, no, like, recovery wasn't too bad. I ended up not going back to work. I think I did take about, like, just about the 6 weeks. It was, like, 5.5 or something like that. I work in a bakery. I have to pick up, like, 50-pound bags of flour. I have to, like, definitely am stretching a lot, so I just, like, my boss was like, take whatever time you need, like, we'll be okay. So I was really fortunate enough that my boss was really understanding. And I think I probably could have gone back at, like, 4.5, 5 weeks. Like, I don't think I needed the full, like, 6 weeks. I definitely, when I went back, I was like, nah, I feel fine. Like, I felt pretty okay because I wasn't in a lot of pain the whole recovery. But I just wanted to I was like, I'd rather not ruin anything. And if I can take the time, I will take the time. So yeah, going back to work was actually pretty okay. I didn't feel much pain. I think my scar stretched like a little bit, I think, because the way I sleep, like I sleep like this, or like my arms are up here. And for sleeping was a whole situation. During recovery, I had to sleep on my back for pretty much until I got the drains out. Like, once I got the drains out, and I had the bandage on, like, I was able to, like, sleep on my side a little bit, and I would kind of, like, twist back on my back. It's weird because now I wake up and sometimes I'm sleeping on my back, and, like, I never used to do that. I always would sleep on my side, so my body just kind of, like, got used to it. Like, I didn't have to sleep in a recliner or anything during recovery. I ended up kind of sleeping, like, completely diagonally on the bed. Like, I couldn't sleep, like, straight, so I slept like this, where my head was, like, up here, and the rest of my body was like that. I think how I got on the bed kind of was like that too. So sleeping wasn't too bad. But yeah, I was able to kind of sleep on my side fully after, like, so at 8 days I got the drains out, and then it was probably like day, like 2 weeks maybe, where I was like fully comfortable sleeping on my side, and when I would like rotate, I would like fully just very carefully flip over to the other side. But no, it wasn't too bad, and once I got my drains out, I was able to drive too. Like, my dad brought me to my appointment for my 8 days, and he drove me back to my mom's house, and my mom's house to my house is an hour, and I drove an hour by myself, like, totally fine, just like very carefully, like, when with the steering wheel kind of just like, this is how I would turn. And so obviously, like, I wasn't in any pain. I wasn't on there was no, like, narcotics, no pain meds, nothing that I was on. So I was able to drive. I didn't have the drains in to worry about. And, like, when I had the drains in too, I was still able, like, I'd gone out a few times. Like, my mom and I, like, we went out to eat, like, we went to the mall, we walked around. Like, I just wore, like, I had an oversized flannel that I would wear, and they would just kind of, like, the drains kind of just, like, hang down. I was able to, I did all of I changed the stuff out of my drains by myself too. I was able to do that, able to, like, the worst part was when you had to, like, so where the drain was, like, the tube, like, pulling all of the blood and stuff like that to the end to then empty it out, and you had to, like, keep track of it all. But I didn't have too much, like, that came out, so that's why they were able to come out. Like, obviously, if you have a lot of like, too much that's coming out, they want to keep them in longer, but mine ended up being fine. Yeah, there's definitely a lot of stuff going on, but it wasn't that bad. I've never had surgery before, and I think going to Tobias was a really good decision, because I wasn't in any pain. I had a really good recovery. My body heals pretty well, and I'm very happy with how everything looks. He said after 6 weeks that I could start going back to the gym. I didn't start going back to the gym until, like, recently. Just personally, I didn't want to, like, I was like, my work is kind of like a physical job, so I kind of wanted to just, like, ease back into everything. So right now it's 4 months, so I would say, like, I waited 3 months to, like, actually go to the gym and be able to just do what I was doing before, by, like, doing stuff at work, getting used to standing again, because I was sitting for so long. I literally, like, I think I gained back, like, most of the weight that I lost. Pretty sure when I got surgery, I was, like, 150, 155? No, 150, and now I'm, like, 160, so I gained, like, 10 pounds from just sitting around, so now I'm, like, trying to go back to the gym and lose that. But yeah, so I'm going back to the gym now to try to, like, work out everything. But yeah, so I waited, like, 3 months to do that, to do physical, like, lifting and everything. But yeah, so I'll show you guys my results now too. Let's see. So it's funny because, like, even through this shirt, you can kind of see, like, my nipples are right there. But yeah, so for me, everything looks pretty good. Like what I was saying about like my nipples are just kind of like around the edges a little dark, but I'll see over time if that like changes or anything. And using those like scar strips, I've definitely like they're really smooth right now. And these two spots were definitely like the hardest, where I would like really do the massages, and you kind of do the massages like that, like pretty like firmly. So the scars go back to about here. So you can see where the drain was here, and it's very faint, the scar. And on this side, it's a lot bigger, because that's where there was just like a weird scab that was there. And when I saw him, I was like, I was taking off my ace bandage, and the scab came off, and he was like, oh, wow, that's bleeding. He's like, I don't know, I'm not quite sure why that happened, but yeah, so like, for where, I'll take my like whole shirt off, but I mean, it's like, yeah, I don't know, I'm very happy. I also had like, I have lymph nodes right here, or fat right here, or whatever it's called. So before, it was like, I just have excess fat here that you can't, like, they can't liposuction it. He just said like it's a genetic thing. You can kind of see it if I do like that. But it was really bad when like I would wear like a sports bra or whatever, and it was just like this fat that was here. And he was like, I can't touch that with the liposuction, because he did obviously do some lipo, and he was like, that's one area that like you would have to see a specialist if you wanted that to go away. But honestly, it like comes back. It's lymph nodes or whatever. Like, I'm like, no, that's fine. That's just a genetic thing. And honestly, he was like, I don't think you're gonna notice it once we, remove everything. And honestly, I don't. Like, I wear tank tops, and it's not like sticking out anymore like how it used to be. Like, you can kind of just a little bit there, but I think doing like chest exercises and stuff like that will get rid of that. I think just working out is the only thing you can do about that. But yeah, so 4 months post-op as of today. I'm really happy with everything. I definitely highly recommend Tobias. Yeah, I don't think, if you guys have any questions or anything like that, you can leave comments or whatever. But yeah, everything, I'm really lucky that everything went really well, very smoothly, and yeah, I'm really happy with the results. And I know that's not gonna be the same for everybody, and it's not always gonna be perfect and whatever, but for me, I really like it. I'm really happy. It's really awesome to wear like shirts now, and not to worry about wearing a binder and stuff like that. So I'm like really thankful and really happy that it all worked out for me. And yeah, if anybody is interested in seeing Dr. Tobias, I would say you should go for it. Set up a consultation. Yeah, especially if your insurance covers it. Like, my insurance covered all of it. Like, I just had to like meet my deductible or whatever. And then the $1,500 cosmetic fee. Like, some people are like, well, that's kind of like a dick move, but I think it's worth it. He's a plastic surgeon. He has really good results. Like, if that's all you have to pay is $1,500, like, that's, to me, that's so worth it. So, I definitely recommend him. If you guys have any questions, please let me know. I'll probably make like maybe like a year post-op video or something like that, if anything really changes. But yeah, but otherwise, I will see you guys in the next video. Thank you for watching. Bye.